This is a demonstration of teleguidance of point-of-care portable ultrasound and integration with Netson. Now, I can tell you that when I started in medicine, ultrasound was a little bit different. Every image looked like a Rorschach test. And fortunately, things have come a long way. Not only is the image quality better, but we're talking about tiny devices that attach to a smartphone and the ability to transmit images. I think the really profound change that we're looking at now is the ability for the local user to not necessarily be an expert, but to tap into the expertise of perhaps a physician, ultrasonographer, other person who's trained in that. And not only to get that person's knowledge in an image interpretation, but perhaps equally important, figure out which way to point the darn thing and how to aim it. And to set it up correctly. Because for all of us who've used ultrasound, there's quite a steep learning curve. So in this demonstration, we're going to show the Butterfly IQ Plus ultrasound and show some of its native capability, which is the teleguidance. In addition to that, we're going to show additional capability that we developed under this Netson portfolio, which is the access and integration of those images wherever you might need them. So with that, we'll begin the simulation by going to the camera and go right ahead. Oh, and microphone-wise, let me just, I think, move this closer to you. Okay, great. Yep. All right, go ahead.
Hi, good afternoon. My name is Rick Mendez. I lead the clinical development at Butterfly Network. I am going to be reaching out via our teleguidance application to Samantha Limepuller, who is in Fort Mill, South Carolina, and is our expert in ultrasound. And so through our teleguidance capabilities, I'm going to pull up Samantha to help me locate some blood vessels in my neck that are critical to find. So, hi Samantha, I'm really having difficulty with finding my neck vessels. So and I was wondering if you can just help me.
Pause simulation, yes, thank you. Keep going.
Absolutely. Okay, so I see that you are in the wrong preset for carotid. You're actually in the abdomen preset. So what I'm going to do is I'm going to change that for you so that we can accurately evaluate the carotid, which now we can see right here in cross-section. And I'm going to actually change your depth just a little bit, just to bring it a little bit more, crispen it up. That's awesome. All right, and one more thing I want to do is I'm going to send you a command to your screen, and I want you to be able to turn on the carotid so that we can see it in longitudinal. So this is going to be an augmented reality overlay that you're going to see, and it's going to show you how to rotate your probe or transducer. That's perfect. That looks great. Okay, so I'm going to go ahead and freeze the image and take an image for you for documentation purposes. And then I'm going to unfreeze. And what I'd also like to do is put on the color Doppler. So I'm going to activate that. That way we can evaluate the blood flow of the carotid. And that looks great. Awesome. Perfect.
Terrific. Thank you so much, Samantha. I'm going to go ahead and end the session and send that image up to the MGH PACS device so that they can review it. So thank you again. At this point, I'm going to send that image that we acquired directly to the MGH PACS for further review.
Okay, thank you, Rick. So now we're sharing the screen on Open Ice, and we're going to navigate on our server located right here using an open source PACS system to the image that was just uploaded to the cloud. We're pulling it back down, and now we're able to select it and view it. And we'll go through that. We'll select, and look at that. Nice. And then we also can, go ahead, you want to speak through it? We're also going to, we can send those images to any web address as well. And so move them around as needed for others to review, analyze, and help with diagnosis. Okay, that's the end of that simulation. So thank you to those who were in Fort Mill, South Carolina, and thank you, Rick.